before you start putting money in your HSA. Any questions?
Right. So now I just wanted to share with you our medical insurance comparison tool. It's currently out there. We have used Clearview for a few years now, but they've actually improved a little, so now it's on a mobile app if you'd like to look at it that way. But if you go to our Human Resources website and go to the link at the bottom that says Open Enrollment, then you will find the information. You'll find the information on all of this. And also wanted to point out that we did do an open enrollment guide this year. We did not make printed copies of these. We did for facilities and dining, but not for everyone. But this is out there as well. And then it's nice because you can go through it and there are links that you just click on for more information and things like that. So that is also, along with the premiums and lots of other information is out there. But the Clearview is the comparison tool. And basically what you do is if you are interested and you're not exactly sure which plan is the best plan for you, Clearview will ask you a few questions. I think it's 4 or 5 questions that you will answer based on your medical, what you're assuming your medical needs will be for 2018. Once you answer those questions, then it's going to show you a comparison of which plan has more value, so which plan would be better. So I've printed a couple of these examples. So this one is for an employee only who very rarely goes to the doctor. So this is a low user. So in this particular plan, or in this particular example, you'll see that there's a 95% value score there for the high deductible plan. Basically, that is the plan that, in this example, would be the best for that individual. Certainly doesn't mean that you have to do what it says, but it's just a tool for you to use. The university does not see any of this information, by the way. So the way it works is, what it does is it looks at the annual premium, and it will compare the 2 premiums. So you'll notice that if you're employee only, it's going to cost you $257 in premiums for the high deductible. It's going to cost you, in comparison, $585 for the traditional plan. Then there's an out-of-pocket. So this individual, even though they're a low user, they did either, maybe they purchased a prescription or they went to see, had a couple of doctor's visits. So in this example, they paid $148 out-of-pocket for the traditional, for the same, whatever that coverage was. They would then pay for the high deductible $329 because they have to pay all of it up to the deductible. And then they also take into consideration the $500 that the university puts into the HSA. So you'll see that the difference there is what they're showing is for this individual, if they had the high deductible plan, they'd pay $86 for the year versus $733. And that's why the high deductible plan is the better choice in this example. You can go back, you can answer the questions as many times as you'd like, maybe answer them differently, just to see what it shows you. So this example is an employee only, but a medium user. So this is somebody, and I can't read it exactly, but they have several office visits. They are seeing a physical therapist, and they have some mental health office visits. So in this particular example, it's showing that the traditional plan would be the better plan, or the higher value. And here's the difference. So it's not a whole lot of difference, as you'll see there, about a $100 difference. So you would want to look at that as well to determine, you know, if you added maybe 1 or 2 more doctor's visits or maybe a prescription or something like that, which way would it go? But you can go back and answer the questions a little differently to see. But in this one, you'll see here, it compares the premiums with the out-of-pocket and then the HSA contribution. And then the last one here is a family plan, and these are high users. They have multiple conditions. I think there was a hospitalization in this example as well. So in this case, the high deductible plan is the better value, and you can see there, it's about $1,000 difference. In this particular plan, the out-of-pocket, this family met their out-of-pocket for the year in both plans, the medical piece. So the premium differential is there, the out-of-pocket is there, and then the $1,000 for the HSA. But the better value in this example is still the high deductible plan. I know sometimes people think the high deductible plan is better for employees who very rarely go to the doctor, very healthy people, but it's also true if you have high medical cost, it is also a good value. It's that in-between that is a little sometimes hard. But the concept of the HSA sometimes makes that it okay maybe if you perhaps are paying slightly more because you are getting that tax advantage by being able to put your money in the HSA. Any questions about any of these? All right, I'm going to let Jen talk to you about the one